2-month-old Ayman arrives at this Idlib hospital with a hernia in his groin. In most places, this is a routine surgery. But with Syria's healthcare system in distress, not all hospitals have the resources and doctors with the expertise to treat him. The Idlib Health Directorate tells Al Jazeera there's not a single MRI machine in this province of more than 3 million people. There's no cancer medication, and the area has only 10% of the primary care physicians and obstetricians it needs. This is the only place left for patients like AHMED al-KHATIB to get dialysis.
Sometimes I come to the center and there's no place to get treatment, so they postpone me and others.
The healthcare system throughout Syria is under assault.
I was working at another hospital that was hit. When you're operating and you hear the airstrikes, buildings are getting hit, it's hard to continue psychologically. We urge the international community to tell the Syrian government forces to halt the airstrikes on hospitals.
Last week, a UN report accused Syrian government forces of committing war crimes in eastern Aleppo for what it described as an orchestrated campaign to target hospitals, medical staff, and ambulances. The World Health Organization reported 126 attacks on hospitals across Syria from January to November of last year. And here in Idlib province, 80% of the hospitals have been bombed during the war.
The Syrian government captured 3 of our doctors, burned their bodies and dumped them in a public square. This was a message by the government telling doctors not to treat civilians in rebel-held areas. This criminal act is a punishment for all.
Mustafa traveled far from his village to be treated after shrapnel ripped through his stomach. He, like everyone else here, doesn't feel safe. They know the next airstrike could hit this hospital. Natasha, Ghoneim, Al Jazeera, Gaziantep, Turkey.